Greetings. Today we will discuss the two types of belly fat that you need to understand. I haven't seen a single online health guru or influencer discuss this vital fact. All belly fat is not the same. There is subcutaneous, relatively superficial belly fat, and there is a deeper fat deposited around one's internal organs called visceral fat. While both are types of adipose tissue, subcutaneous abdominal fat and visceral fat are biologically and functionally distinct organs. In the context of 2026 metabolic science, the distinction is no longer just about location, but about how each type of fat communicates with the rest of your body. At a glance, subcutaneous fat, SAT, and visceral fat, VAT, differ mainly in their location, function, measurement, and impact on health. Subcutaneous fat is found just beneath the skin and is the type you can pinch. It primarily serves as energy storage, insulation, and protection for the body. It can be measured using simple methods like calipers, the pinch test, or visual observation, and is generally considered metabolically neutral unless present in extreme amounts. In contrast, visceral fat is located deep within the abdominal cavity surrounding vital organs. It acts as an active endocrine organ, playing a role in metabolic signaling. Measuring visceral fat typically requires advanced methods such as CT scans, MRI, DEXA scans, or estimating through the waist-to-hip ratio. Unlike subcutaneous fat, visceral fat poses a high health risk and is strongly linked to insulin resistance and various metabolic diseases. I'm the digital avatar of Dr. MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired extensive specialized health-related knowledge that he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now, let's get back to today's topic, but before that, I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. Subcutaneous adipose tissue, SAT, makes up roughly 90% of total body fat for most individuals. This is the fat you can feel at your waistline, often referred to as love handles or a muffin top. Protective roles. It acts as a shock absorber for muscles and bones, provides thermal insulation, and serves as a stable energy reservoir. The safe depot. Biologically, SAT is considered a safe storage site. It is less metabolically active and tends to store fatty acids in a way that doesn't interfere with organ function. In fact, moderate amounts of subcutaneous fat in the hips and thighs, gynoid fat, are often associated with a lower metabolic risk in women. Visceral adipose tissue, VAT, is hidden behind the abdominal wall and tightly packed around vital organs like the liver, pancreas, and intestines. This is often called active fat because it behaves more like an endocrine gland than a storage tank. The portal circulation connection. This is a critical scientific distinction. Unlike subcutaneous fat, which drains into the general systemic circulation, visceral fat drains directly into the portal vein. Liver impact. This means free fatty acids and inflammatory signals. Cytokines from visceral fat go directly to the liver. This direct path triggers insulin resistance. The liver becomes less responsive to insulin. Dyslipidemia, increased production of bad LDL cholesterol and triglycerides. Systemic inflammation, continuous release of pro-inflammatory markers like IL-6 and TNF-alpha. Even if two people have the same body mass index, BMI, the one with a higher proportion of visceral fat faces significantly higher health risks. This is why some individuals are referred to as TOFI, thin on the outside, fat on the inside. Cardiovascular disease, VAT, increases blood pressure and arterial stiffness. Type 2 diabetes, the chronic inflammation and liver fat loading directly impair glucose metabolism. Dementia risk. Recent 2025-2026 studies suggest a strong correlation between high VAT-SAT ratios and an increased risk of cognitive decline and Alzheimer's. Cancer link. Visceral fat produces growth factors that may encourage the development of certain cancers, particularly colorectal and breast cancers. Since you cannot eyeball visceral fat accurately, clinical tools are necessary for a precise distinction. DEXA, scan. Modern 2026 DEXA software can specifically isolate the android region and calculate a precise VAT-SAT ratio. CT and MRI. These remain the gold standard for imaging the exact volume of deep fat surrounding the organs. Anthropometric cues, while less precise, a waist-to-hip ratio, WHR, of $, greater than $0.9 for men or is greater than $0.85 for women, is a strong indicator that visceral fat is accumulating at a dangerous level. Understanding your fat distribution is the first step toward a precision health intervention. At the Age Reversal Technology Center, we don't just look at the scale, we look at the hidden fat markers that dictate your future health. Visceral fat is a silent driver of biological aging. Call us at the Age Reversal Technology Center at 941-806-5511 to schedule your metabolic blueprint audit.